Wears, Akure. I am Mrs. Fashionati. We are located at Captain Cook Building, directly opposite First Bank, Alagbaka, Akure. We stock stuffs from newborn, from pregnancy till teenage age. That means from 0 to 19 years. We have various stocks what your baby can wear right from the immediately you give birth to your baby till teenage age, from bodysuits, sleep suits, their outing wears, their singlets, pants. We have the shoes. We have a lot of beautiful stuffs, lot of mouth-watering stuff that you can buy for your children here. Heavenly kids, good-looking children are happy children.
Parents who know how to care for their kids begin to care right from when they are in the womb to the time of birth and throughout their teenage years. Such caring parents are passionate about what their kids and teenagers wear and how to make them look good at festive periods and always. Such lovely families are regularly found at Heavenly Kids and Teens Wears, shopping for their prenatal and postnatal needs, teenagers wears and shoes, school bags, lunch bags, and lots more from the cities of Europe and America.
Mom, this place looks heavenly.
And such parents know that good-looking children are happy children.
This message is brought to you by Heavenly Kids and Teens Wears.
Just like a diamond, you shine from far away.
Good afternoon. You are welcome to Mother's Delight on MEC Radio. From anywhere that you are listening to us, yes, once again, the program is Mother's Delight on MEC Radio, and I am Oluwafumike Adenino. And as you know that on Mother's Delight, we always bring you interesting topic pertaining to motherhood, pregnancy, childbearing, and everything. And you know, today on the show we'll be talking about a very important topic in pregnancy. And before I go into the details, we'll go on a show. And you know that this program is proudly sponsored by Heavenly Kids and Teens Wear. Yes, Heavenly Kids and Teens Wear is located at Captain Cook Building, opposite First Bank, Alagbaka, Akure. You can visit them for all your prenatal and postnatal wears and other stuff for yourself and for your child. We'll go on a short break now, and when we return, we'll go into the topic fully.
This is for boy, this is for girl, newborn babies from 0 to like 12-18 months. This is their sleeveless for boys. We also have for girls. This is immediately you get back to the baby. This is the section, the cross section of where to start from. The bodysuit, the sleeve suits, everything, the booties, everything, we have them. Everything, the blankets, the shawl, the baby warmer. We have the baby shawl, the baby nursing pillow. We have all the wears, beautiful stuff. We have the baby mats that you can play with when you have your outing. We have all nice wears, beautiful stuffs. We have their feeder, we have their towel, we have their travel bassinet, the baby bath, the outing wears, the church wear.
Parents who know how to care for their kids begin to care right from when they are in the womb to the time of birth and throughout their teenage years. Such caring parents are passionate about what their kids and teenagers wear and how to make them look good at festive periods and always. Such lovely families are regularly found at Heavenly Kids and Teens Wears, shopping for their prenatal and postnatal needs, teenagers wears and shoes, school bags, lunch bags, and lots more from the cities of Europe and America.
Mom, this place looks heavenly.
And such parents know that good-looking children are happy children.
This message is brought to you by Heavenly Kids and Teens Wears.
Just like a diamond, you shine from far away.
Yes, you are welcome back. It's still Mother's Delight on MIEC Radio, and on the show today, like I said earlier, we'll be talking about a very important topic, and it is malaria in pregnancy. And you know that I'm not always alone on the show. All your questions about malaria, is it that malaria affects pregnant women differently from the way it affects individuals, the causes, the signs and symptoms, the prevention and treatment and stuff like that? Yes, all your questions will be answered today on the show, and Nurse Olukoya is right with me. She will be doing justice to the show, and let's welcome Nurse Olukoya.
Good afternoon.
Yes, you are welcome on the show today. Yeah, on speaking on the topic malaria in pregnancy, I want to know, for people that are at home that don't really know, the thing there is that malaria is a very common ailment that everybody knows about. But what's really special or what's really important about malaria in pregnancy that pregnant women or people out there, even singles and men too, need to be aware of this, that they need to know about?
Okay, we all know that malaria is a parasitic infection caused by mosquito. So for the reason why it's different in pregnancy is because you are not you are carrying a live baby. You understand? So pregnancy is a delicate period, journey of 9 months. So it's not just your whole self. You understand? You are carrying a baby, so it's very important. That's why malaria in pregnancy can be quite different, because it can affect a lot of things, which we're going to talk about on the show.
Yes, as you've heard Nurse Olukoya said, the way malaria affects pregnant women. If you don't know before, now you know that for a pregnant woman, what Nurse Olukoya is trying to say now, that pregnant women are at a more greater risk of malaria. Is that what you're saying?
Yeah, not really, but malaria in pregnancy is it's a very big topic to talk about, because it's quite different. It affects the baby, it affects the woman too.
Okay, yes, okay, now I get it better, and I know you do too. And before we continue with the topic, I would like to tell you that you can follow us on Facebook at www.facebook.com/MIEC Radio, and you can also listen to us on www.mieconline.com. And for your question, if you have any questions, comment, you can leave your comments on Facebook. And for comments and questions as well, you can call in on the show on 07048754886. Yes, that is the number to call to participate. Now we'll go more into details about the topic. Like you said the other time, please ma'am, I want to know, let's talk about malaria generally now. What are the causes of malaria? Because there are actually some myths and misconceptions about malaria. Even me, when I was small, I used to believe that, because that's what people say do, when you go out in the sun, you have malaria or something like that. Yes, I want you to do justice to that, the myths and misconceptions about malaria. Yes, I want you to talk about it. Okay,
so we all know that malaria is caused by mosquito. It's a parasitic infection caused by mosquito. So once a mosquito that is infected bites someone, so the person will develop malaria. Yes. So we know the signs and symptoms. It comes with fever. It comes with severe headache, fever. The person will be feeling cold, chills. Some people might not have nausea, wanting to vomit. Some people will vomit. Then we have some, as I said earlier, that chills, cold. The person will be feeling cold. The temperature will be high. That's fever. Then some people too, they will have bitter taste in the mouth. Yes. So that's the general thing about the signs and symptoms of malaria.
Yes. Okay, like she just said now, if you have a misconception about malaria, yes, Nurse Olukoya just debunked that. Like, it's not when you go out in the sun that you have malaria. And there's something that you said something now about the signs and symptoms of malaria, like headache, fever, cold and shivering, nausea and vomiting. But then we are talking about malaria in pregnancy, and these are normal symptoms too, or for you to know that you are pregnant. Like, there are things that is usually occur during pregnancy. But I want to know, how would you know that if you have symptoms like that, if it's malaria or not?
Okay, on normal ground in pregnancy, in a healthy pregnancy, okay, after the hyperemesis gravidarum, that's the vomiting, early morning vomiting. You know, it should stop after the first trimester, or like middle of second trimester, it should stop. So for the difference between the signs and malaria is that, okay, for a normal pregnant woman shouldn't have severe headache. Then there are some fevers that the way you will know that is malaria. You might like feel all right all through the day. All of a sudden in the night you're having chills, or your body is hot. You just develop this, your body just change, or it's a particular time of the day. Probably you're feeling fine in the morning, all of a sudden in the afternoon it's like that, and it goes again in the night. And it starts again in the afternoon the next day. You know that definitely this is likely to be malaria. Then you shouldn't have a headache in pregnancy, except you have a high blood pressure. You shouldn't have headache. So once you continue to have persistent headache, you should know that there's something wrong. It's likely it should be malaria. And that's why once you think it's malaria, it's not that you just go and treat yourself. You need to go to the hospital. The tests need to be done on you before you start taking drugs. You don't just take drugs like that.
We will still get to that place. We get there. Like you just heard Nurse Olukoya right now. She said yes, the symptoms of malaria can be the same with that of pregnancy. But then she said when you are having persistent headache, and she also said something that I'm going to hammer on, and we will still get there later. She said that when you feel all these signs and symptoms like shivering, like you are normal during the day, and all of a sudden you are having headache without having high blood pressure, she said you should visit a medical practitioner. It's not like you just go to one chemist and go and get over the counter drugs. Yes, we get there. But then there's something again too that I want us to talk about, because so many people, they don't know. Like you said the other time, like there is so much more to malaria, especially during pregnancy, because the woman is not alone. She's carrying a life inside of her. So I want to say, like, what are the side effects, like what the things that the havoc or the things that malaria can cause for a pregnant woman and the baby if not treated or well treated?
Okay, for malaria in pregnancy, we have complications of malaria in pregnancy. So one of the complications of malaria in pregnancy is anemia. So because of the malaria in pregnancy, malaria can break down blood cells of a pregnant woman, and on normal ground in pregnancy, a woman needs a lot of blood. That's why you will see that in the hospital they give women folic acid, they give them supplements, they give them hematinics to boost their blood. So but if there's malaria, it breaks down the red blood cell, thereby allowing the woman to have little blood or no blood at all. It depends on the severity of the malaria. So it breaks down, reducing the blood of the woman. So one of the complications or side effects of malaria in pregnancy is anemia. And anemia is not good for not just the woman, for the child, because the blood cells are really important for the baby. Those are how the baby helps the baby develop. So if the blood is not enough for the mother, how will it be enough for the baby? So one of the major complications is anemia in pregnancy.
we will still talk more on the complications, because I know that there are still some complications. But I would like us to go on a short break now. We want to go visit our sponsor. As you know that this program is proudly sponsored by Heavenly Kids and Teens Wears, and Heavenly Kids and Teens Wears is located at Captain Cook Building opposite First Bank, Alagbaka, Akure. We will go on a short break now, and when we return, we will talk more on the complications.
I'm right here to introduce to you Heavenly Kids and Teens Wears Akure. I am Mrs. Fashionati. We are located at Captain Cook Building, directly opposite First Bank, Alagbaka, Akure. We stock stores from newborn, from pregnancy till teenage age. That means from 0 to 19 years. We have various stocks what your baby can wear right from the immediately you give birth to your baby till teenage age, from bodysuits, sleep suits, their outing wears, their singlets, pants. We have the shoes. We have a lot of beautiful stuffs, lot of mouth-watering stuff that you can buy for your children here. Heavenly Kids, good-looking children are happy children.
Parents who know how to care for their kids begin to care right from when they are in the womb to the time of birth and throughout their teenage years. Such caring parents are passionate about what their kids and teenagers wear and how to make them look good at festive periods and always. Such lovely families are regularly found at Heavenly Kids and Teens Wears, shopping for their prenatal and postnatal needs, teenagers wears and shoes, school bags, lunch bags, and lots more from the cities of Europe and America.
Mom, this place looks heavenly.
And such parents know that good-looking children are happy children.
This message is brought to you by Heavenly Kids and Teens Wears.
Just like a diamond, you shine from far away.
Download our radio hub on Google Play Store and Apple Store. Miek Radio.
I like it.
Yes, you are welcome back. It's still Mother's Delight on Miek Radio. In case you are just joining us, we've been talking about malaria in pregnancy, and Nurse Olukoya has been doing justice to that. We've talked about malaria, how malaria affects pregnant women, and we've talked about the causes, and we are still on the complications. If you are just joining, you've not missed out much, and you can watch us on www.facebook.com/Miek Radio, and we will continue with the topic. Nurse Olukoya, we were talking about the complications of the malaria in pregnancy, and you talked about anemia. I want to ask now, are there other complications that you'd like people to know, our audience to know about?
Yes, we have.
Okay,
so the second major complication for malaria in pregnancy is increased uterine contraction. Okay, so for a pregnant woman with malaria, increases the uterine contraction, thereby allowing the woman to have a labor, like false labor. Yes, so it will be as if the baby wants to come. The contraction will increase. So because of this, if it's untreated, it causes a lot of things. It causes abortion, because in this kind of case, because of the malaria, because of the infection, it thereby causes uterine contraction, thereby allowing it, doing as if the baby wants to come, so it can expel the baby if it's untreated. Yes, so causing abortion. Yes, and it can also cause preterm birth. Like the baby is not term yet. It's not yet 39 weeks or 40 weeks or 38 weeks for the baby to come. But because of the untreated malaria, the baby will firstly want to come, and the baby might eventually come, thereby causing preterm births for a baby. Then it also causes low birth weight for a baby. Yes, because the baby is not term yet. Yes. So and because of the we talked about anemia. Yes. The baby is not getting enough blood. Yes, the nutrients. Yes. So the baby will be small. It won't come out the size. Yes. So thereby allowing the baby to be low, but the birth weight to be low. The baby will not grow as it should grow. So then also lastly we have uterine deaths. That's the baby might die. Neonatal death. Yes, the baby might die inside. Yeah. Then we also have fetal distress. Okay, because we've had series of cases that the woman is pregnant, and because of that, all of a sudden when we want to hear the heartbeat of the baby, it becomes very fast or very low. So because of that, the baby is affected. The infection has affected the baby. Yes. So because of untreated malaria. So once it's treated, you will see that if the patient has, or if the mother has all those signs before, you will see that once if the mother is treated, all the signs goes off. There will be no contraction again. It goes off. The breathing of the baby will normalize. The heart rate will normalize, and it will be as if there was nothing that happened to the baby. And for the baby who is not growing well, once the malaria is treated, the baby start getting enough nutrients back again. Wow. Yes.
Seriously, I'm learning a lot, and I do hope that our audience too, like, they are learning too, because on a normal day I would never have believed that malaria could have side effects as grave as this, like causing anemia and preterm labor, low birth weight, and uterine contraction. Yes. Okay, causing thereby it can lead to abortion.
Yes, because the baby will just the uterus will be contracting, and the baby will want to come out. Eventually the baby might come out.
Okay, yes, that's actually it. Seriously, I never knew malaria could be as grave as this. And this will also lead us to the treatment for people listening to us at home. What are the measures, like when you notice that you have malaria, and because of our time is running out, I want you to quickly run over through the treatment, the prevention of malaria as during pregnancy, like we are talking about.
For a mother who is having malaria already in pregnancy, all she needs to do is go to the doctor and she'll be treated. Then it depends on the severity of the malaria. Some people, because of the effects, uterine contraction, some patient has to be admitted and treated on bed, and the malaria treatment has to be given. Some patient might have to, IV fluid might have to be given to rehydrate them. Then hematinics. Then also because of the most of the time all this blood tonic affects the efficacy, the effectiveness of the drug, of the drug. So because during the period treating malaria, your doctor will tell you to avoid all those blood tonics, because it reduces the effects, the effectiveness of the drugs. So because of this, once the patient is treated or the mother is treated, all this the side effect goes. The anemia becomes, it resolves, the contraction resolves on its own. So that's the major treatment of malaria. Then we also have the prevention. So majorly they say prevention is better than cure. Yes. Okay, on normal ground in pregnancy, we have this drug, it's prophylactics, that's what it's called. It's a drug you take before it happens. So you just avoid having malaria. So normal ground in pregnancy, you're supposed to have like 3 doses of malaria treatment in pregnancy. So once you see that your baby has started moving, the movement occurs around 18 weeks to 20 weeks. Once you perceive that the baby has started moving in you, you take the first dose of the treatment, of the malaria treatment. They will tell you in the hospital once you start going for antenatal, and that's why it's good to go for antenatal. Yes, they'll tell you the period. Once you go there, they'll give you the anti-malaria and you will use it. The second dose is supposed to be taken in the second trimester. So once you take the second dose, then you take the third dose a month after you take the second dose. Once you take all this, eventually you might not have malaria all through pregnancy. And this malaria in pregnancy, it mostly occurs for first-time mothers. It's always frequent in first-time mothers than the people that have had babies before. So as a first-time mother, you should know that you need to take malaria treatment in pregnancy. You don't need to have it yet before you take those doses of malaria treatment. they are prophylactics. They are supposed to be used before you are infected with malaria. Then also, you know, you as a pregnant woman, you should sleep under treated nets. Those are the preventions. Yeah, sleep under treated nets. You know, use insecticide. Treated nets, treated nets. Yes. Then you also use insecticide. You make sure your environment, you fleet with insecticide, so to prevent mosquitoes. Then also your environment must be clean. There must not be waterlogged. You must not be living in a waterlogged area, because waterlogged area breed mosquito, and with that mosquito you have malaria, mosquito breeding of mosquitoes. So you should cut down all the grasses, the damp waters in your area. You should make sure it's cleared off to prevent mosquitoes from biting you. Thereby, with this, you're preventing malaria. Yes. So that's a major prevention of malaria in pregnancy.
Like you just said, Nurse Olukoya just said, if you are having malaria in pregnancy, and I know with all the complications that you've heard, you might be scared, because even me, though I'm not pregnant, I'm scared as well, because I never knew that malaria has a lot of complications, like she said. And if you have malaria, there's a way out for you. It can be treated, and there are preventions as well.
Also, we know that malaria is like one of the number one leading cause of death in Nigeria. Yes, so we should know that it can also kill as a pregnant woman. It even kills faster in a pregnant woman, because the immune system is already low for a pregnant woman. Not like somebody that is just alone, not pregnant. So please, when you're pregnant, make sure you use the prophylactics for malaria, and do the necessary, sleep under treated net, do the necessary to avoid malaria, because of the complications we've talked about.
Yes, all these complications can be avoided if well prevented. You can sleep inside treated nets, let your environment be clean, and don't forget, and most importantly, like you said, go for antenatal, especially first time mothers.
Not just first time mothers, all mothers.
All I said especially. Yes, because the immune system of a pregnant woman is low, like Nurse Olukoya actually said. And with this, we've come to the end of the of Mother's Delight on MIEC Radio. Nurse Olukoya, thank you for doing justice to the topic. And don't forget to join us again on Wednesday, as we will be bringing another educative, informative and entertaining topic pertaining to motherhood. Yes, that is all we do. And this program is proudly sponsored by Heavenly Kids and Teens Wear, located at Captain Cook Building opposite First Bank, Alagbaka, Akure. I remain Oluwafumike Adeniro. Join us again same time on Wednesday. Please stay with us. Thank you.
Parents who know how to care for their kids begin to care right from when they are in the womb to the time of birth and throughout their teenage years. Such caring parents are passionate about what their kids and teenagers wear and how to make them look good at festive periods and always. Such lovely families are regularly found at Heavenly Kids and Teens Wears, shopping for their prenatal and postnatal needs, teenagers wears and shoes, school bags, lunch bags, and lots more from the cities of Europe and America.
Mom, this place looks heavenly.
And such parents know that good-looking children are happy children.
This message is brought to you by Heavenly Kids and Teens Wears.